There shouldn't be any centralized authority saying, this is good or this is bad. That's where I think the problems lie. And that's, where we see this horrible, history in the United States of forced sterilization. I mean, this is like the worst, affront to humanity to say to some person because of whatever property, you don't get to
reproduce.
Have a child. That's exact opposite history of IVF, right? It's IVF is saying, even if you're infertile, we want to give you the ability to have a kid. And now it's expanding that scope to no matter what disease you have in your family, you have more choice and more opportunity to mitigate that risk of the next child based on your own personal preferences. So that's, I think, one reason why I get really activated when they're kind of lumped together, because they're literally the exact opposite thing. One thing is saying some people shouldn't be able to have kids, and the other thing is saying, no, we want the maximum number of people who want to have babies to have a healthy baby, whatever healthy means specifically to them.
Hello friends, welcome to the Win-Win Podcast. Today I am speaking to Noor Siddiqui. Noor is the founder and CEO of Orchid, a reproductive technology company that is the first in the world to offer whole genome sequencing for embryos made during the IVF process. And prior to Orchid, she studied computer science and worked as a researcher in AI at Stanford. She was also a Teal Fellow, so a very impressive resume, especially for someone so young. But the main reason I wanted to speak to her is because fertility technology is arguably one of the most societally relevant technologies on the horizon right now. I also wanted to talk to her on a more personal level because Igor, my partner, and I have started our own IVF journey, and so want to understand what are the full range of options available to us as prospective parents. So yeah, a pretty juicy conversation, as you can imagine. And before we dig in, one other quick thing to say. Igor, who joins for the conversation, is an early stage investor in Orchid. So just factor that in as a disclosure for you guys. Here is our conversation with Noor Siddiqui. This has been a conversation I've been wanting to have for a while because, 2 years ago now? 3 years ago?
Yep, 3.
Igor and I did a round of IVF and got 5, hopefully very healthy embryos out of it. Which
Congratulations.
Thank you. This obviously got us thinking about what realms of technology are opening up whereby we could understand more about what the likely health of our embryos could be. Which got us interested in genomic testing, and that's what you specialize in. So could you explain what genomic testing is, first of all?
Yeah, so for embryos specifically, genetic testing has historically been really limited. So limited in the sense that it only looks at chromosomes. So the way that I like to talk about chromosomes is that they're like chapters in a book, right? So if you have a table of contents, that's all that the existing embryo testing looks at. It tells you, do you have the correct or incorrect number of chromosomes? Do you have 23andMe, 23 pairs of chromosomes? So do you have an extra chromosome? Do you have a missing chromosome? Do you have an extra chapter? Do you have a missing chapter? So it's really low resolution in the sense that it's just telling you about basically this table of contents, do you have the correct or incorrect number? But the really major advance that Orchid has been able to achieve is we can do whole genome sequencing, which is sort of akin to saying, instead of just looking at that table of contents, let's do typo or spell checking across the entire book. Let's look at every single letter. Let's look at every word in each chapter. So the thing that's really important about that is that there's a really small fraction of genetic diseases, for example, Down syndrome, that are the results of the abnormal number of chromosomes, right? So Down syndrome is trisomy 21, so you have 3 chromosome 21s, right? The vast majority of chromosomal abnormalities are actually not compatible with life. So monosomy 1, only 1 chromosome 1, that's usually, or I think, just not viable. That will not, it's not enough data to make a human.
So just to be clear, so this is instances where basically, like Down syndrome, you have 3 copies of one chapter in that book.
Chromosome, yes. So chromosomes are organized from largest to smallest. So chromosome 1 has the most data, and then your sex chromosomes and chromosome 23 is one of the smaller ones. So that's some of the theory around, okay, why can you have 3 chromosome 21s? And that's actually, this is a unique case where the wrong number of chromosomes is actually compatible with life, which is Down syndrome, which is still a pretty serious condition.
Okay, so you guys, or at least the technology has now opened up so that you can read every letter in the book.
Yes. Yeah.
How many more, just to get an idea of the amount of data, is this what numbers are we talking about here? Is it 10x, 1000x? What's the ratio?
Yeah, it's about 100x. So most technology that looks at chromosomes, you're looking at, well under 1 million data points versus whole genome sequencing. You have 3 billion base pairs. You're looking at 3 billion data points. So it's basically well under 1% of the genome compared to 99.6%. So the entire genome. And then in terms of like the number of diseases that you can look at, those typos that you can have in genes, there's literally thousands of genetic diseases that are the result of typos or basically the wrong letter. And none of the old technology detects it, which sucks. So then there's there's birth defects, there's miscarriages, there's all these things that people unfortunately aren't able to catch until NIPT. So basically once you're pregnant, there's this thing called a blood draw where you're able to look at not just chromosomes, but something called microduplications and deletions, so small extra and missing pieces of chromosomes. So you get to know a little bit more at that point, and then you get to know basically everything at birth, right? So you can do newborn screening or screening on adults, but unfortunately at that point, it's often, too late, right? There's a large number of conditions that you can treat and manage, but there's unfortunately another, really large fraction that you can't, right? If you're talking about a heart defect or a skeletal defect.
If I remember correctly, when was the human genome first entirely screened?
The early 2000s.
Yeah, and sequenced, and that was like a multiple billion or hundreds of millions of dollar project.
Yeah,
at the time,
I think it was over $1 billion. Yeah.
Yeah, it was insane.
Very expensive.
So I imagine it's also in part because the cost now has come down such that because we had the capability to do the whole genome screening already before, but now we can also do it at a price that is comparable.
Yeah, exactly. So basically part of the reason why genetic screening has been limited for a while is because microarray. So microarray is basically looking at a small segment of your genome. So the way that you can think about it is like, let's say you're only catching the word cat. So that's what a microarray is doing. It's looking at certain words or letters or sequences, and it's just capturing that instead of the whole book, right? So basically, the first set of technology was arrays, because that was what was cheap and affordable to just capture, some set of variation. And then basically, as whole genome sequencing got cheaper and cheaper, the data sets got larger and larger, where it's not just array data, but it's whole genome data paired with a medical record. So basically, what that's led to is just the really, really large scope of diseases that you can screen for, right? So basically products of conception. So when someone unfortunately miscarriages, they sequence that tissue, and then they find out, oh wow, there's these different types of subtle variations that are linked to miscarriages. They sequence, folks with autism, intellectual disability, seizures, cancers, right? And this set of diseases that they've now, gotten enough data for has just gotten so large that now there's just in my opinion, like a massive advantage for parents to be able to screen for that all up front rather than, finding out about it once it's too late.
Well, before we go to the parents and children, like the thing that most people are familiar with is 23andMe, and having done that type of screening, that was on that array chip that
Correct.
Only allowed for, I heard it actually was like 6,000 data points or so it collected, or was it
I think
still
it's
in the
probably
millions,
around,
you think?
I think it's around 800,000 is probably.
Okay.
About 1 million. So it's still, I don't know. I actually still think that's really useful, right? So one of the criticisms that they usually get is that they don't screen for all BRCA variants, right?
What does that mean?
Okay, so BRCA is a gene that makes you more likely to develop breast cancer if you have certain variants. So their first version of the technology looked at basically a very, very small number. So there's over, I think, 75,000 variants of BRCA, and they all have different effects, and there's different variants in different populations. So basically, I think that their original, looked at maybe 10 or so variants. So basically, it could be false reassurance, because you could find out that, oh, I thought I was negative, but it only looked at 10.
Right.
So what are the costs right now? So say, Igor and I, we have our embryos.
Yeah.
Because I think I'd like to spell out exactly what the process is for people. Yeah. We've had our embryos. They are in blastocyst phase, which is where they've got 128 cells. Is that
64? I think.
Is it smaller? Okay, I don't know, but they're very, very small. And at what point in the embryo development stage do you actually take the sample and test?
So yeah, basically, just to back up even a little bit further to like how IVF works, most people know, but what happens is that the female partner is on hormone injections for about 10 days. What this is doing is that it is maturing eggs in her follicles. So your ovaries have follicles, and basically you're retrieving a bunch of eggs. So one really important misconception that I think is really critical to get out of the way about egg freezing and IVF is that people think that when you, retrieve your eggs, that you're accelerating menopause, that you're stealing eggs from the future. That's not true. So I can see why people would think that, but that's just not how it works. So what actually happens is that every month, unfortunately, we lose anywhere from dozens to hundreds of eggs. They just naturally die. And what IVF and these medications are doing is that they're maturing or basically getting a larger fraction of these that you can store. So these eggs would have died anyway.
I actually didn't know that as well. I was part of the misconceived individuals. I thought, because the thing that many people have heard is that every female is born with all of the eggs already inside of her that like you'll ever have, right?
Yeah.
So that, I think that's probably where in part it comes from, that you assume that hence you're kind of like taking, you would have had 68 left and now you've taken 20 already out. But actually you're saying that the person who is about to have, say, they're in their late 30s, 40s or whatever, and they might only have 100 cycles left prior to menopause, they actually have not 100 eggs, but probably over 1,000 still in there then.
Yeah, exactly.
Okay, cool. Wow.
Yeah, so basically depending on the specific woman, there's like a different amount that she is losing every month. But yes, it's not just one. That's the thing that I think people don't realize, is that there's actually so many of these follicles or eggs that are lost per month. The other thing that is just really cool about that is that when an embryo or like human is growing, the first thing that develops is actually not your heart or your brain or your lungs. It's actually your ovaries. Like the embryo's ovaries and eggs, right?
I remember hearing this. Technically, the egg that made you existed inside your grandmother's body.
Yes.
Your grandmother was growing your mother inside of her. Your mother's eggs.
Yes.
Then the one that turned into you were developing as the first thing. That's nuts.
Yeah. So I just think that's, I don't know, super mind-blowing. So anyways, that's mind-blowing. But anyway, so how do embryos get made? So you do this egg retrieval, which does not accelerate your menopause. It is capturing the eggs that you otherwise would have lost. Then your male partner will produce a sample. You fertilize the egg and the sperm, and then over 5 days, that embryo grows into a blastocyst. So the edge of the embryo, which is going to become the trophectoderm, which is called the trophectoderm, which is going to become the placenta, is the cells that are sampled for genetic analysis. So you have about 120 cells or so at day 5, and about 4 to 6 cells are sent to Orchid or any other lab for genetic analysis.
On our story, we ended up, because we were in a rush to do IVF, we ended up not doing genetic testing of them in an extensive way. We did whatever the lab provided as a service, which was kind of like against the usual diseases. Because I'm Jewish, it like also screened for Tay-Sachs and a few other things. Then later, I was wondering what else could have been done. And it seems like it's only now coming out, but unfortunately, I don't think we can quite do it now anymore.
Right. Could we, because it would be damaging to the embryos to unfreeze them to extract.
So it depends
more
on
cells?
the lab. So basically, this is a little bit of a technical point, but if your embryos were frozen on day 5 or 6, it's usually possible. But if they're frozen on day 7, it's not, because there's a certain age that the embryo is supposed to be when you want to transfer it back into mom.
Right.
And it also just depends on the skill and the experience of the embryology team in the lab.
And what type of costs are we talking about here now for this full genome screening?
Yeah. So it's about $2,500 per embryo for 30x whole genome sequencing. So that's basically similar to the cost. It's actually probably a little bit lower than like an adult clinical whole genome sequence. So basically during an IVF cycle, you can make anywhere from like 5 to 20 embryos. So it just depends. It could be 12,000, 25,000 in total, depending on how many embryos you want to analyze. But I do like to create like a big asterisk on this, because I think people have two responses. Some people are like, oh my God, that's super expensive, or other times, oh my God, that's so affordable, right? And it really just depends on your context, right? So like for me specifically, my mom has this condition called retinitis pigmentosa. So she started progressively going blind in her 30s. So for me, I really wanted to do IVF to basically screen my embryos, because if you have like this life experience of like someone you care about's life getting hijacked, it's sort of like super obvious, and like the cost is very minimal. So specifically for her, what the interesting story is that there was actually a gene therapy for her condition RP that was developed. It was the first gene therapy that was ever approved, and it was approved in 2017. And it costs $800,000 per eye, and it doesn't reverse the blindness; it just prevents it from progressing. And then the worst thing is that it only treats 5% of people with RP. So the other 95% have a different. So it treats RP65. So my mom doesn't have that specific variant. So that's the other thing that I think people don't realize is that, there's so many different types of genetic disease, and gene therapy takes 10 years, over $1 billion to come to market. There are side effects, and it's super expensive. I mean, obviously, most of them are covered by insurance, but...
And I'll just define quickly, gene therapies, if I understand, that's basically fixing a disease that has a genetic root once the person is alive and an adult.
Yeah, exactly.
Right.
So basically, one of the ones that was most recently approved treats sickle cell, right? So basically, gene therapy, the idea is that you have a broken copy of a gene, and then you have something called a viral vector. So this viruses are really good at cutting and pasting DNA. So you find this virus, and then it replaces that broken gene with a functional copy. So that sounds easy, right? Cut and paste is easy on Google Docs, but it's really hard for biology. Basically, the biggest problem with gene therapy is delivery. It's really hard to figure out which virus can deliver in this cell type. And anyways, it's actually, unfortunately, very hard and expensive to build. So gene therapy is, I think, one of the most exciting things in modern medicine, but unfortunately, it's really, really bad at solving this problem because, so this is something I think most people would find shocking and don't realize, but there's actually 30 million Americans with rare disease, right? So rare disease sounds really innocuous. It's rare.
But that's 10% of the population.
Yeah, but it's 10% of the population. So rare means, in the US anyways, rare disease is defined as under 200,000 people being affected. But if you add up all the thousands of genetic diseases, you end up with 10% of Americans, and they're totally neglected by pharma and medicine because gene therapies will never be able to treat all of those different typos that are causing all of those different symptoms. So they're just leashed to drugs for life that are off-label uses of other medications. So I just think that's just incredibly unfair. So that's why I really wanted to build this. I really wanted to build it for myself, and I kind of just want it to be. I want it to be just something that everyone knows about as an option, right? I don't believe in anyone being pressured to do something one way or the other. But like, at least for me and for my mom, like I think like the most trajectory altering like health decision that parents will ever make is probably the decision to screen their embryos, right? Like if you choose to go to private school, have organic food, all of this, that's not the difference between like pediatric cancer and not pediatric cancer. So I just feel, just super passionate about it. I think probably from having the lived experience of something going wrong and seeing how damaged, because a lot of people actually minimized my mom's condition. They're like, oh, well, she got to see until she was 30. It's like, okay, but then you got your, like always, because there's also more aggressive manifestations, right? Some people start losing their vision like as teenagers or even younger. So yes, I obviously think she's grateful for that, but no, I mean, it sucks to get something like your vision hijacked because it's so tied to your independence. And that's just one of like literally thousands of horrible things that can happen to you. And the fact that we've spent so much money and time on sequencing and cataloging all these diseases, like it just seems like a huge misuse and waste to not make it available in embryos, because that's when you can actually make a difference. You already have multiple embryos, and now you can choose which one is least likely to develop any disease that we know of, right? Like the newborn screening that's happening is great, but now you're just punting the problem. You're sort of waiting for symptoms to emerge, and there's not a gene therapy that's actually going to be able to cure it.
I've seen you described before, people spend more time doing research on Yelp about where to go get lunch than they do about how to increase the likelihood of having very healthy future children. So it sounds to me like really you think the value add of this project is giving people choice, essentially. Yeah. It's providing information. We now have, within the realm of technology, the ability to get this information about the likelihood of a certain person developing very bad diseases, and basically saying, okay, there's a way through technology to have it so that you can make sure your children will grow up to have the greatest chance of being healthy. But that obviously raises a plethora of ethical questions, right? Because I could imagine, I can empathize with the position of people who have a lot of, they have a genetic illness, and they might be hearing this and saying, well, so you're saying that had this technology existed when I was born, or when I was conceived, I may have not ever come into existence. And to me, there doesn't seem to be like a clear answer to that, right? And I can like totally see why that would be an upsetting proposition to people. What would you say to that?
Yeah, I think that the thing about genetic testing and reproductive technology and like why it's so stigmatized and carries so much weight is because it does feel like it attacks people's identities, right? And I think that you can hold the view that, people like with my mom's condition, retinitis pigmentosa, like, they're just as valuable as someone without it, right? Someone with cancer is obviously just as valuable as someone without cancer. People often conflate the two as like, this means that you're, somehow devaluing people with a specific condition. And I don't think that's the case. I think if anything, hopefully this will make it so that we give more resources to people with the current, with those conditions, because right now, there's too many people with the disease and we don't have enough resources into finding cures. So that's the first thing. And I think, the second piece of it is that I think that it's really just fundamentally about parental autonomy, right? So I think that no one should tell a mother and father which embryo they should transfer into their own body. It's really just about no one should be interfering with, which spouse that you choose, when you choose to have kids, whether you choose to have kids at all. So I think that's really the other piece of it is that I don't think anyone should be meddling or interfering with someone's personal decision about which disease they want their child to either not to have, to minimize the chance of their child being affected or not affected by a specific condition. So another example is that is kind of the opposite of this, is that there's already people who have gone through IVF who are deaf, who have chosen an embryo that is deaf because they want to have a child that's deaf, that's part of their community. So a lot of people would be outraged by that. They would say, well, why would the doctors approve that? Why would right? So my personal opinion is that I would not do that to my child, but I respect the autonomy of those physicians and those that individual who really valued that for their family. People in the deaf community feel differently. I'm sure that there's people who don't want their children to be deaf. I'm sure there's people who want their children to be deaf. My experience and my mom with vision loss and blindness is that it's not something that she wants. It's not something that I want for my kids, but I think it's fundamentally about expanding choice and expanding autonomy for people. And with something as, intimate as your child and your pregnancy and your embryos, I just feel like, at least the future that I'm excited about is like just maximizing really high quality information and then, just leaving it up to the parents and the clinical team to make the decision that's right for their family.
So that does raise another question. Then it's like, okay, if you are having the information of which, let's say you do a round of IVF, you get 10 embryos and you find out that some are more likely to have certain diseases than others, and then some people actively choose that. Yes, I agree. That sets off a moral intuition to me that seems wrong, but I don't know, that opens up a can of worms of people who potentially want to like almost experiment through their children, right? Is that an area that you think there should be a hard and fast rule against that? Or do you really think just like always defer on the side of choice?
That's a question that really societies have to answer. So for example, China and India don't reveal sex of embryos. It's actually illegal to do that in those countries. So I think as a society, we kind of decide what are the boundaries of parental choice. What information do we want to censor? What information do we want them to have in making that decision, right? So, they've made the decision that sex is too much in their societies, that it shouldn't be revealed there, right? In France, I think this is really hilarious. Most people don't know this, but you actually can't get a paternity test in France unless you get a court order.
What?
I'm not going to make any assumptions about why that is very disruptive in French society, but so I think every society has to choose what boundaries they want on information. And I think, my personal stance is, maximize parental choice, maximize parental autonomy.
And by the sounds of it, maximize information.
Yeah, maximize information. And I think there should be very clear, regulation and guidelines around the quality of that information, right? This is information you're going to make an incredibly critical decision. So you should make sure that information is high quality, it's validated, it's vetted. But I think what decisions people make with that information, I think, to me, I feel very strongly about having it, right? Because, there's right now in the prenatal setting, so basically, what conditions adults can get screened for, there's a huge amount of paternalism. They'll say, okay, we're only going to look at recessively inherited disorders. There's dominant disorders, there's there's so many different things, but we're only going to look at this really small fraction. And that's the extent of what carrier screening is. And I think that's, it's paternalistic to say those are the only conditions you should worry about. There's plenty of people who, they want to mitigate the risk for hereditary cancer, right? They might have, BRCA, right? That's not included on most carrier screens. So I think it should really be up to the parents how much information they want, what risks they want to mitigate. And I really hate when people minimize other people, right? So some people will say, well, why would you be worried about schizophrenia or bipolar or Alzheimer's? It's like, if you have a family member with that condition, you know and understand it at such a deeper level, what it actually means to live with that condition. And I just hate seeing people minimize and say, oh, well, you shouldn't worry about that because of the base rate or because da-da-da-da. It's like, well, if you have firsthand experience with it, you probably know a lot better what it means. And
that's
what
the thing.
It's
like, the families that are actually at risk of it are the ones who probably already have more information. And so I do agree. It seems a little poor taste for people who have no insider info of what it's actually like to experience that and to pass that on.
They're not on a hook for like the lifetime of medical bills, the huge emotional burden, the huge physical burden. I mean, these families are heroic, right? They completely reorient their lives. They start nonprofits. They do incredible. So one of our first early, users, he literally self-compounded a drug at home that was totally out of commission in the entire world because his daughter had a mutation in a gene called KCNQ2. There was only like 3 other people in the world that had it. He contacted the one family who was like
a real
5
1
years
in a billion type thing.
Yeah, and it it sucks, right? You have a spontaneous mutation that affects your kid. I mean, okay, it's rare for someone else, but it's your life, right? And the fact that anyone would try to attack someone like him or someone in that category for maximizing the amount of information so that their next child doesn't have to be affected. I feel very strongly about that ability being on the table for the people who choose it.
Yeah, I think one thing that also is often the underlying cause for people disagreeing with some of this is it's related to status quo bias or like the naturalistic fallacy, where there is an inherent assumption that, you have babies the normal way if you can, and there you just roll a die and whatever comes out, and that's the baby you were meant to have.
Yeah.
And it's kind of odd where, and then you had a miscarriage and you were meant to have a miscarriage. I don't understand whether that's then the case, and you were meant to have the next baby. And then it comes with a certain set of genetic diseases and you're meant to have them. It seems very weird that there would be such a strong kind of like stance behind it.
I think that reproductive technology specifically is super plagued by this, right? So if you look at the history of reproductive technologies, so something like epidural, right? Like pain relief during pregnancy was incredibly stigmatized. You think it seems like obvious, right? Why, if a woman's in pain, why would you not help her, right? But then there was the church and this desire that, women are supposed to be, birth is supposed to be painful, right? God. Even to this day, it's stigmatized. It's seen as, somehow natural childbirth. What does natural even mean? Somehow that, without a medicated childbirth is somehow inferior, right? There's like this weird machoism among women for delivery where, I didn't need to whatever. So I think that, again, it's really just about offering the choice and not stigmatizing the choice. For some people, they have, there's a huge variety in birthing outcomes, right? People literally die during delivery. People have, hemorrhage and have insane complications. And then there's also, on the other side of it, people who have orgasmic births. Why would you demand the woman who's having an orgasmic birth to do an epidural? No, she's enjoying the experience. Like, let her better be. But for someone who's...
I'm sorry, there are orgasmic births?
Yes, it's very rare. but yes.
Tell me more?
Yeah, some women orgasm during birth, during delivery.
Huh?
Yeah, it's a thing. I wish we could have more of it.
That needs to be studied.
I agree.
You want to fix birth and fertility rates? Because frankly, that's one of my biggest, I don't think it would be that's not the thing that's been holding us up or giving us difficulty, to be clear. But
I know, that sounds like really exciting, right?
Wow. It's bizarre how much of a range there's
a huge range.
So the point is there's no one size fits all.
Yes, there's no one size fits all for anything. So anyways, I guess kind of going on my rant about reproductive technology. So epidural is it just pisses me off that people stigmatize that, and it's still stigmatized today.
With the stigma, I wonder, like the thing that with all of these naturalistic arguments always struck me is like, where is the cutoff from nature to non-nature? I don't quite get. Like, it is like God gave us, in that view, God also gave us free will or free choice making, right? That was
and an amazing
that was
brain.
the main thing, exactly. And now we're not allowed to use the brain to create medicines. And if it's grown as a plant and it functions as an epidural, that's okay. But once you put it into a syringe, like, where's the cutoff?
No, but here's the other thing that really pisses me off about that specifically. It was okay for, men on the battlefield. It was okay for, when your arm is broken. But then when you want to use it for, women during childbirth, that's when it starts to become... And that's what I think is interesting about reproductive technology, that there's a specific sensitivity around childbirth, around, how women should have babies, right? So the other, like, kind of example is birth control, right? So when birth control was first introduced, it was literally criminalized in the United States. It was against the law. There was obscenity laws. It was considered obscene to use birth control, right? That's something that we totally take for granted today, right? The idea
Does that include like condoms, or like, is it just the pill itself?
The pill itself.
Okay.
The pill was marketed initially under something else, right? And it had this side effect as well. Was that
that was basically the second stage of it, right? So after it was stopped being criminalized, then it was, okay, now your husband has to approve it. So you can't use it if you're not married. So now your husband has to sign off on it. And then it was, you have to see it. Like, it was just this, it's always this like intense process to give women choice and give, people choice, right? And then similarly, IVF was, considered, just this horrible, affront to humanity. And it's just every single technological advance in reproductive technology, from epidural to birth control to IVF, was always this like heated, intense debate. And I think the same thing is happening with embryo screening. I think that, we're going to look back on it as like the same as the way we see birth control. It's like, oh my God, obviously I'd want to choose when I have a baby. And, obviously I'd want to have, paid relief, right? Like, there was also this huge, strife, and there still is to this day, about like home birth versus hospital birth, right? So hospital births, you have really, much lower rates of, infant and maternal mortality, right? But, there's lots of, women who have low risk pregnancy, let them give birth at home if they want, but they're criticized, right? And then women who are who choose to give birth at the hospital, they're also criticized. So it's just like, I think we just need to have a little bit more empathy that your life decisions
are yours.
Yes, exactly.
Right.
What do we know about trade-offs? I take out the genetic disease, and damn it, I also killed their ambition. Not ambition, but something more likely. Like, now they will never have brunette hair. I
think this is like an incredibly interesting topic. So I think one of the examples that's probably most well known is if you have sickle cell, you actually have resistance to malaria. So that's an interesting genetic trade-off, right? So that's why you see a lot more of sickle cell, that condition, in Africa, because there's much higher rates of malaria there.
Nature selects for it, essentially.
Yeah, exactly. So there are these interesting situations where there are genetic trade-offs. That's basically a monogenic or single gene example.
Is it because it is the same gene that does both, or is it that they are next to each other and...
It's the same gene that does both, right? So basically, the thing that gives you sickle cell, the way that it changes your blood cells, is the same thing that makes you very resistant to malaria. It just has to do with how it infects and how it affects blood cells. The way that you see it much more often is actually, I would say, with polygenic conditions. So with polygenic conditions, you're talking about the cumulative effect of millions of genes. So typically the correlations are they're associated with a similar category of condition. So if you're more likely to develop schizophrenia, it's also associated with bipolar disorder and a lot of other psychiatric conditions. Similarly, for heart conditions, if you have high risk for heart disease, it's also typically higher risk for atrial fibrillation, other sort of cardiovascular conditions. So there's also a lot of labs that are doing these giant maps, these like correlation maps of like, okay, but what about positive and negative correlations for all of these? So I'd say some of the trade-offs that have been found is sort of there is a trade-off between schizophrenia and creativity. So I think this is like a really super interesting area, and I think the trade-off, the impact of trade-offs, I think, is a little bit overemphasized because of this like canonical example, I think of like sickle cell and malaria. And I think that people don't give enough credit to the sort of, I would guess, like free lunch argument of like, okay, well, a lot of psychiatric conditions are actually correlated with each other, and a lot of, cardiovascular conditions are actually correlated with each other.
So what's the stage of the science on the polygenetic markers then currently? Because I would imagine sounds like it's more complex. You're looking at many more genes. Is it in many cases we kind of don't know very specifically whether it increases or reduces the rate?
We're very good at stratifying risk. So what that means is that, if you're in the 99th percentile of risk, let's me just back a little bit like how they work. So the way they work is that you take really large cohorts of people and then you say, what are the variants that are correlated with the disease? What variants are enriched in people, with heart disease that people without heart disease don't have, right? You have these labels, lots of SNPs, and then you have this label of did they get a heart attack or not. So you build this model, and then what you end up with usually is that people in the sort of the 97th, 98th, 99th percentile, they have the disease at 3, 4, 5, up to 10 times the rate compared to average. So average being the 50th percentile. So people look at that very differently, right? So some people will say, oh, I definitely don't want my embryo to be 5 times as likely to develop heart disease. Other people will say, oh, well, the base rate of the disease is low. So even though, so for example, for something like schizophrenia, I think the base rate of the disease is 1%. So even if you're, 5 times more likely, that's 5% versus 1%. So they'll say, 4% is a small difference, right? But well, if you compare it to the alternative, which is, well, there's no diet, exercise, medication that reduces your risk by 4x, then it sort of seems more powerful. So it really just depends on how you frame it. And again, I don't think you should make any opinions about what is the absolute risk reduction or relative risk reduction or percentile reduction that is meaningful. What's meaningful depends on what's important to the family and what the alternatives are, right? So for something like heart disease or diabetes, maybe your lifestyle can manage and mediate that disease a lot more. Much more is known about how to manage it, right? For something like maybe schizophrenia or bipolar, well, there's not as many alternatives for people to consider. I think another example that I think people are more familiar with to understand the difference between maybe polygenic risk and monogenic risk is smoking, right? So smoking, massively increases your risk for lung cancer. But if you actually get into the nitty gritty of how much it increases your risk, I think it sometimes can surprise people. So let me just pull it up because I don't want to get the numbers wrong. So basically, if you smoke 1 to 5 cigarettes per day, you have an 8% lifetime risk of developing lung cancer. And lung cancer is typically diagnosed at about age 70. And if you have 35 plus cigarettes per day, then you'll have a 26% chance of developing lung cancer by age 80. So in other words, you have a 90+% chance of not developing lung cancer if you have 1 to 5 cigarettes per day. And you have a 75+% chance of not developing lung cancer if you have 35 plus cigarettes per day. Some people would argue, that's a 9% difference. So 90% of the time I'm not going to develop the disease. But that's massive. I think people just literally just don't understand how to interpret the numbers. I'm not saying that you should smoke. Smoking is bad. It is insane. Right. You do not want to be 10 times more likely to develop a disease. 10% is should not put up with that. So anyways, I just think people sometimes will minimize these, single digit numbers because they don't understand the framing of there is no alternative. And basically like there's plenty of like blockbuster drugs that are making drug companies billions of dollars that are moving, they'll say 45 or 50% relative risk reduction, but then the absolute risk reduction is like 1 or 2% rate of heart attack reduction. So anyways, this is it can go to arbitrarily deep topic, but I think with giving people information, you also have to put that information in context.
Yes.
And that context should not be deceptive, right? So I think it would be correct to argue that displaying relative risk inflates it, right? Because you're saying, 60%, 70% because it sounds bigger. But it's also deceptive to only do absolute risk and to not present the alternatives and to not talk about smoking, because these are also, it all helps framing, well, how much does any specific thing that I'm investing in actually move the needle on my child's health?
Let's say this technology becomes ubiquitous and cheap so that everyone, now this is the way that you have babies. No one is having, or very few people are very few people are having natural conception.
Sex is for fun, IVF is for babies.
Sure. We barely understand, I'd say we don't understand how genetic diversity really works.
Yeah.
And the complexity that is arising from it.
Yeah.
Because it seems like throughout nature, when things have evolved, even these horrible diseases, it's rare that there are accidents, right? Or at least there seems to be some evolutionary purpose to these things. So is there a risk that by eradicating a realm of diseases from the gene pool, that we are messing with something we just don't understand?
Yeah, it's like a super interesting thought experiment to go down. So I think that, so I guess first layer of it is that, so kind of this objection is sort of like unknown unknowns.
Yes.
We don't know what it can't do. So yes, there's always unknown unknowns, right? So even when you have a drug go through a clinical trial, well, what if in 40 years the person drops dead because of the drug, right? It's like, we never let the criticism of unknown unknowns stop us from almost any other technological or medical innovation, right? We test all the things that we can test, and then the unknown, there's always an expanding set of them. So that's just my general criticism of the unknown argument. But then specifically, the idea of like reducing genetic diversity, I think that that's interesting, but I think that specifically for this current way that embryo selection would be done, it's not a huge risk because the embryos that you create are the natural variation between the two partners. So you're not really reducing the variation of genetic diversity. I mean, I guess if people only have one kid, then you are, because they're not having 3 or 4 or 5, the number that they were usually having. So you do have a reduction in genetic diversity just by the number of kids that people choose to have. But in terms of the natural diversity that exists, you're just sampling from that. So there's that. Second, there's a huge class of the conditions that that we screen for, that you look at, that result in basically people who are not able to have kids, right? So these are, birth defects that result in, childhood death or early adulthood death, or basically a consequence of some of these conditions is infertility. So, some of these conditions are so severe that people are not able to live alone or to have kids of their own. So for that other set, it's not really changing the overall genetic diversity. Right. But I think that if you get into this situation where there's lots of these polygenic conditions, and for some reason there's like some meme in society where everyone gets obsessed with like one specific combination, you could end up shifting one way or the other. But I think that's a pretty extreme and remote possibility, because even with like I think the power of like mimetic desire today on the internet, I think people still, there's always that person who's like, I want to be like more contrarian. It's like, oh, well, you like red, I like blue, or whatever type of thing. So I think that at least something that I've been surprised by is that I think people's preferences for their kids are actually more diverse than people think, right? So I think the canonical example people always give is like, if you could do traits, to be clear, we don't do traits. Everyone would select like blonde hair or blue eyes, right? But I wouldn't do that. They wouldn't look like me. So I think a lot of times these criticisms people have reflect a little bit more, their own prejudices about what they would want personally, which again, I think is fine. They should be able to select what they want, but it's not necessarily representative of every single person's preferences. Like, for example, even with the limited that we can test for right now, like some parents have chosen they want to have a child that's deaf and other people, have not. So this is like, even in the very limited amount that we have been able to do historically, we're already seeing that diversity.
Obviously a big fear when I was reading about this and so on is like, okay, when have like the topic of designer children, and I mean that eugenics basically, been issues in history? It's been when there's been centralized top-down control of crazy people trying to control what the population looks like. And while I think it is true that this technology, genetic screening technology, in theory could enable such a thing to happen more, at the same time, the technology is hand in hand with allowing individuals more choice. And from what I understand, the concerns of eugenics is when it's basically taking people's choice away. It's basically saying, no, these types of people are wrong, these types of people are right, and it's coming from a very centralized point.
Yeah, I totally agree. So basically, I feel incredible, like the strongest possible. I am really against the idea of any sort of government control, physician control, or any sort of not the parents' control over this information, because yes, I think it does lead to these horrible abuses, right? There shouldn't be any centralized authority saying, this is good or this is bad. That's where I think the problems lie. And that's, where we see this horrible, history in the United States of forced sterilization. I mean, this is like the most the worst, affront to humanity to say to some person because of whatever property, you don't get to
Reproduce.
have a child. That's exact opposite history of IVF, right? It's IVF is saying, even if you're infertile, we want to give you the ability to have a kid. And now it's expanding that scope to no matter what disease you have in your family, you have more choice and more opportunity to mitigate that risk of the next child based on your own personal preferences. So that's, I think, one reason why I get really activated when they're kind of lumped together, because they're literally the exact opposite thing. One thing is saying some people shouldn't be able to have kids, and the other thing is saying, no, we want the maximum number of people who want to have babies to have a healthy baby, whatever healthy means specifically to them.
I mean, sometimes, though, the choices, I think, have also been made by parents, where if you look at population pyramids of certain countries, you see that through some age bracket, they have many fewer girls than boys.
Yeah.
And it looks horrific when you actually look at it because of the implication of what must have happened at the time.
Mm-hmm.
But actually, I think they've gotten there, sadly, without IVF. They've gotten there by
just infanticide,
other terrible means of actions.
Yeah, I think it's also a really difficult position that we're putting pregnant women in now, which is like, okay, you find out about trisomy 21 Down syndrome or whatever when you're already 10 weeks pregnant. And I personally, I think everyone should have the right to a termination if they want one. But it also is really difficult to make that decision, right? Mm-hmm. It's extremely taxing on the body. It's extremely taxing emotionally. So I think that's another thing people don't realize is that when you screen embryos, you're able to identify risks for all of these at once, so that you actually lead to fewer terminations, whether that's natural termination, meaning a miscarriage, or it's an elective termination due to the very, very, very small number of genetic diseases that you can detect once a pregnancy is already in progress.
Right. We have some of the screening is already part of most IVF procedures and done and legal in the US, right? Like Down syndrome, for example.
Yeah,
and
exactly.
A number of others, like in my case, Tay-Sachs, which we did.
Yeah.
Yeah. So basically, you're adding a few more for the large number more, I suppose.
Yeah, thousands more. But I guess the distinction I'm specifically making is like, it sucks to make the decision once you're already pregnant. And for me personally, I would way rather avoid everything possible before I'm pregnant, even though I am. Like, that's another thing I think people don't realize is that, you can be, pro-choice, pro-termination, but also acknowledge that, a termination is taxing and a lot of people want to minimize it. And I think people just don't realize that there's this door on the left, which is okay, but if you screen your embryos, then you're more likely
we're avoiding this problem in the first place. So in theory, that should placate some of the pro-lifers as well, right?
Yeah. I mean, I don't know, or it makes them more upset.
Depends what they define. I mean, if they define the moment of conception, at the same time, I think there's a scale of people as well. They're not a monolith.
Yeah.
Right.
Same as the pro-choice people are not a monolith. I have an intuition in that the earlier in the embryonic to baby process you make that decision, the better.
Yeah.
Right, prior to a nervous system being developed and so on, which presumably at the blastocyst phase, it's just
you can't even see it with the naked eye.
No,
there's no sex in the first place. That's
that's the way the society seems to be going. So actually, on that note, I would love to pick your brains a bit on the fertility crisis, because looking at the numbers it's not even just the Western world, even like Bangladesh was a shocking one, right? That was, I think it was at 5 babies per woman 30 years ago, and now the number's down to 2.
Yeah.
So around replacement levels. So it just seems to be a trend across the world that fertility rates are dropping. Do you have any particular suspicion of something that's driving it beyond just preferences? Because it's like, if you don't mind me saying, we have not been on birth control for years and we've never gotten pregnant. And it's always made me wonder, what's going on there? We're pretty healthy people.
And we've also not been celibate.
And we've also not been celibate,
There would be another explanation.
There would be, yeah. So not that either.
Yeah.
And just speaking around, yes, okay, I'm in my late 30s, but I was in my early 20s when we got together. And speaking around to other people, it just seems the rate of fertility issues in otherwise healthy couples is going up. So is it just the microplastics? What is it?
Yeah, I mean, unfortunately, we don't know. But yeah, we think that, there's just basically this growing body of evidence that, phthalates and basically all of these different microplastics, they're endocrine disrupting, right? So your endocrine system is what, derives your testosterone levels, your estrogen levels. And yeah, male fertility is plummeting, right? So now I think that the sperm counts are sort of 50% what they were, about 30 or 40 years ago. And, we don't know why, right? We think it has to do with this like constant exposure to chemicals, but it's also so difficult to study and disentangle because it's just like nutrition where it's like, oh my God, there's like thousands of different exposures, right? You ban one type of plastic or BPA or whatever, and then they just replace it with another that's like slightly modified. There's like this like cat and mouse game, almost like security with, with all the different chemical exposures, right? But what we do know is that in industrialized countries, men have much lower sperm counts. But what's nice is that since they have so much sperm, it's usually still okay. But
you can get rid of a few million.
Yeah, you could know. So I think a normal a milliliter of sperm should have like almost like 100 million, and now it's about 50 million, and then basically subfertility numbers sort of like 30 million or something like that. So kind of most men, I mean not most, but like a lot more men than previously are on the sort of edge of being subfertile.
And I think for IVF, they used like 20 to 50,000 sperm or so that get into their chemical style obstacle course. It was explained to me until the one winner comes out.
That's another thing is that basically
sperm Olympics.
Yeah, there's a sperm Olympics. And the other thing that's so crazy about sperm is that people don't realize how many sperm are abnormal, right? So like 3 tails, no head, like all this insane variety. Like I think I'm forgetting the number, but I think it's something like normal morphology is something absurd, like 95% abnormal and 5% normal is like good. And I was like, what? So I don't know. Sperm is really insane. The other thing I thought is really insane is that semen is actually can kill eggs. So semen is like only needed as a vehicle to get the sperm to the egg, but the actual exposure of semen to eggs will like kill them. So they learned this when they were developing IVF because you have to do these really aggressive washing steps, right, to like mimic what happens in the cervix. And it's basically just like it's like almost like this poisonous road that they're taking to the egg.
Wonder why that would have evolved.
Maybe to kill more. So that the best, I don't know, who knows? But basically, during IVF, they do the same process that mimic the process that happens naturally, which is like you have to do this intense cleaning to make sure that sperm that hits the egg is not
doesn't have
contaminated
any,
with semen,
right.
which is apparently
Bizarre.
toxic. Who knew it was toxic? Yeah. But fertility crisis, just to like, I guess, riff on that point is like, I don't think people grok that, okay, I think when you say these numbers like, 1.6 or 1 or whatever, all these numbers of how much fertility is falling, it's like, okay, what that actually means mechanically is that the population cuts in half by 50%. Like you have 50% fewer people. Okay, that's a huge deal. It's a really big problem because it means that all of our social support systems collapse, right? You don't have people, contributing to society to make it so that Social Security and all these retirement benefits actually exist. They suddenly collapse under the demographic pressure, right? You don't have as much innovation because there's not enough young people who are like making new things, right? It's like it's a huge problem. And then in getting to the symptoms or like why we think it's happening, I think some of them are like pretty obvious, right? Like, careers are like basically education and like the amount of time it takes to establish a career is taking way too long. Like women in medicine have like twice the rates of infertility as outside because it's like, okay,
right, they're in school for 7 years.
15 or something. It's like,
right.
It's horrific. So I think that's like a super obvious one that, we could probably fix. But I think like the more insidious one, which I don't know if you feel, but I just feel like on the coasts, I think that being a mom is just stigmatized. Like it's not celebrated in the way that it used to be. It used to be that like if you're a woman and you're a mom, that's like, oh my God, you're amazing. That's like so cool. And I really think that that's shifted. I think now it's stigmatized. It's like, oh, you're just a stay-at-home mom, or why don't you also have a career? And I think again, it's kind of going back to that choice of like true freedom means that none of these paths are stigmatized. It's like if you want to be, focused on your kids for however many years, that should be celebrated. If you want to be focused on, being a CEO or whatever, maybe quote unquote, previously conceived as a masculine notion, then go celebrate that. But I think right now women are caught in this like impossible thing of like, okay, you have to like, do like 100 hours a week in your job and then 100 hours a week in your kids. And then basically they're caught in this like
just die the rest of the time. Yeah.
Yeah, exactly. I don't know how you feel about it or like what you think is like, what's going on with your friend group or just...
I mean, at this point, most of my female friends have, certainly the ones of my age, have had kids.
Yeah.
For me personally, I just never had much of a desire. I was never one of those... Like my cousins, who are also girls, were very interested in dolls as children, and I hated them. I just wanted my planes and my cars. Yeah. And I've never had the same level of maternal drive as other women. I'm only starting to feel it now in my late 30s. Yeah. Which is one of the reasons we pushed for like, okay, let's get ourselves some optionality because I'm getting old and we've got to, these eggs are shriveling up. So I'm very glad we did that. But it's, and I think in part that came from, now whether that was from society or something that was just within me from a young age, but the idea, I never saw myself as being satisfied from being a mother, at least solely. I've always been very career driven and wanting adventure. And I associated having children with like giving, like that's no more adventures for you, which obviously it comes with huge trade-offs. Like you can't now just up and go to the Himalayas or whatever.
Yeah. So I think this is a great point. So basically I think I fully sympathize with that. And I think I've been like really inspired by listening to like, I don't know if you know, Julia Hartz, she's like the CEO of Eventbrite, but she talks about how like there's, and then I think Robin Hanson talks about this too, about basically there's way too much parenting effort, right? People think that like when you have kids that like, okay, now you're a bad parent if you just go and take them to the Himalayas randomly, or like you're a bad parent if you don't like completely reconfigure your life around them. And in the past, it wasn't like that. In the past, it was like, the kids did their thing. I mean, again, I'm not that old that I can really speak from experience about how parenting was 60 years ago. But like the pressure on parents to like reorient their lives, I think is too much, especially since it's in combination with like less integration of family, right? It also used to be the case that
grandparents live with you. Huge.
So it's like you're cutting off childcare that was built in, and you're cutting off independence at the same time. And I think that like these conceptions are like really tough to break. But I think at the same time, I think what you're saying, you know, you shouldn't lie to yourself too about like how your life is going to change when you have kids. So it's like it's like a combination of like having good mental models of like breaking the stereotype and doing what feels right for you, but also acknowledging that, okay, yes, like this is a like living, amazing, you know, human that needs to get nurtured. And like, what does that, you know, what does that involve?
I think a good way to look at the fertility crisis that I think is the most useful framework is to consider it from the lens of opportunity costs and taking an economic lens. So we've seen fertility rates go down in all of the developing countries when they become richer, right? And female education opens up. And what happens is that your opportunity cost from having children grows because your opportunities increase in number and quality consistently.
Right. Yeah.
So it becomes very rational actually to have a higher threshold or higher need for children at that point, and that's why you see them go down. And from that if you take that perspective, like what would help to increase fertility rates? Again, what many countries have tried is something like child support by like basically paying them, right? But that only goes so far. I think only Czechia has succeeded, and other countries that tried it goes back down usually. But what has also worked is what you could imagine is like if you did the evil version of it and you flip it, it's like take away female education, make the country poorer, and then probably fertility rates will go up again as well. But that's the bad version.
Don't put out ideas.
So, no, but I think it helps to think about it in that way.
Don't you feel kind of weird? Is it like historically somehow that like women like had no other choice, basically? Is that kind of what it's saying?
Yeah.
Well, I think historically it was a value you could provide to the family and the tribe to make more children that then can keep contributing. And you didn't have that many other things to do probably as well. Now you have many more options. So I looked at it as I was working on giving grants to various like increased fertility rates efforts you can basically reduce the costs for having children or increase the benefits from having children. We actually touched on this just now on a number of these, right? Increase the benefits would mean, for example, doing stuff like what you touched on culturally. Like it's culturally just not as respected anymore as it used to be. And that is a benefit that you could increase. Reducing costs could mean either child support, or it could also be in the benefit side, or increase help with childcare would also improve it. Or like the SNU is great, right? Because it reduces the cost of when you actually have the child, what you have to do. But actually that is why I got interested in IVF and genetic screening in the first place, because as I understand, like you were 36 when we did it, and natural conception at 42 would have become unlikely and very difficult. At 45 now, basically a very, very rare thing. Whereas if we do IVF at 36 and then implant it into you at 42, the success rate is many, many times higher than 36, right? So the cost to the woman from having children goes down if you can do your life a bit longer and have the child at 42 rather than at 36. So I think that's a great opportunity that opens up from it. And that's why I was looking into investing into various fertility companies, because I think the world will need it. As you pointed out, the dependent to contributor ratio is currently going to the dumps, like really, really heavily.
What do you mean?
Well, in each country where the fertility rates are dropping, you have an amount of people that are currently like contributing to the social welfare system, and other people that are depending on the social welfare system. And actually, if you look at it on the population pyramids, the widest section in most Western countries is like the late baby boomer stage and a little bit beyond. They're currently in their 60s, early 60s. They'll be probably not contributors anymore. It's kind of a mean word to use, not a contributor anymore. Like they were contributors, but still, that's the term. In like 5 to 10 years, so then we'll have a little bit of a step change where now you'll have, instead of like that rate, it's going to drop quite significantly. And absent AI and robotics, we will need something to come up from somewhere to have social welfare systems still work. And it's either go poor, no social welfare, or have more children or immigrants, right? I think we should have probably more children and more immigration, both. But yeah, anyway, I'm really into IVF because it allows for more children.
Yeah, I just think that it's super interesting that, basically younger egg in whatever age uterus ends up with, basically super high rates of healthy kids. It's just like, it's so cool that we figured that out. And it's so cool that it's a consequence that is able to help, not just people with infertility, but basically anyone who just wants to extend their timeline, right? But the other thing that I think is really interesting about IVF and, embryo prioritization is that basically it used to be that IVF was just for people with infertility, but now so many people are electively doing egg freezing. They don't have any infertility issue. They're doing it because of this optionality of, okay, well, they want to have kids after 35 or after 40, and how can they do that in a healthy way? And another thing that I think is really appreciated or not understood is that, you might be able to have that first kid by 35 or 40 or whatever age, but then now what about if you want to have 2 or 3 kids, right? So that's another thing that IVF and embryo freezing really helps with, because again, it extends that timeline where, people kind of advise you want to have like 18 months between pregnancies, right? And that's like a lot of time, right? If you're trying to have a kid at, before 35, like that ends up being, super, super difficult. So I just wish that like this set of imagination and investment in reproductive technology was way greater to kind of like help fix that, cost versus benefit situation. Because like when you think about artificial wombs, people only talk about it in the context of helping premature babies. And I think that that's obviously amazing, right? It's super sad that there's this like critical window where, your lungs can only breathe, this infant's lung can only breathe, liquid and not air. And that's when, most of these preemies are currently dying, because the incubators can only help you after that critical period of lung development. So it's cool, the idea that you could save more, premature babies. But I think it should be in the public imagination that this would be an amazing engineering feat that would help liberate women, again, with this choice of, okay, yes, some people have those orgasmic births, let them have, 20 babies.
They love being pregnant.
They love being pregnant, and that's an amazing experience. But for some people, they have, horrible, pregnancies. Like, 90% of women have vaginal tearing, right? So people don't even talk about that. Like 90% of women have vaginal tearing, right? They have levels of it. Okay, level 1 versus level 2, level 3. Level 4 is like you're literally tearing from your vagina to your sphincter, right? It's like that.
All the way, you just have one big hole.
Yeah, and it's like has to be sewn up, and it's like, okay, I feel like if men were going through that, they'd be like, yes, let's do artificial boobs. And anyways, that's not to say. I mean, whatever. I mean, obviously on cost, all of these women are super happy that they gave birth. And like, I'm not trying to, pregnancy and delivery is all beautiful, but I just wish that there was more energy and effort around this mission of like, let's do artificial wombs. Like that's actually an amazing thing that we should bring to the world rather than all of this like, I think there's way too much negativity around it, similarly to all the other reproductive technologies of like, this is an option that should be opened up for all these women who have, really complex pregnancies. Or just again, like, why is it so stigmatized that, okay, like that's just a lot to put your body through, and you want to be a surfer or whatever it is that it's difficult to be pregnant for. Like that shouldn't be stigmatized either.
Yeah, I think part of the concern, certainly for me, when I hear about artificial wombs, is like we barely are scratching the surface again of the complexity going on within our bodies and information transfer, and presumably there is actually a lot of information going on being passed through the mother's belly into the child from just like the mother walking around and speaking and hearing the mother's voice. And presumably any artificial wombs, to make sure that they capture that information, are going to have, I don't know, it seems like we're a long way off from understanding that fully and making sure that we're not missing out on anything. So what are your timelines on where you think, do you think it would be possible to completely grow an embryo from IVF without ever having to be implanted into a human? Do you think it's possible? Is it possible to capture all that information? And see, if so, what's the timelines?
I think from like a first principles perspective, I think that there's a lot of engineering problems, but there's nothing that seems obviously impossible about it. So I think it should be pursued with like maximum effort. And I think to your point about all these different ththings about like the interaction with the mother's body, super interesting, not enough science, not enough research going into it. And I think, there's the positive and the negative, right? The positive is like, okay, they'll hear your voice and things like that. But I think also women today are under like an enormous amount of stress, right? Like if you think about the cortisol levels of women today versus 50 years ago, that's probably not good for the baby, right? And then also cortisol.
Scrolling social media.
Yeah, I think
seeing doom every day. Yeah, doom scrolling.
Yeah. So I think cortisol levels and their interaction with pregnancies should be studied more. Maybe it's the case that an artificial womb could actually create a more optimal, like the most optimal environment for a pregnancy, right?
Yeah, that's a good point.
Like, think about all of our chemical exposures that we're exposed to. Maybe it's a kind of dystopian, right? Like maybe we should just we should be more chill, right? Like we should have more less chemicals in our life, and we should push the world to that so that women can carry. But I guess it's more
being practical.
I think it's also just about epic goals that people are behind, right? Like the moon mission was this like epic goal that like all of humanity was like, it just captures your imagination, and it's like so cool, and you're like, wow, we can like be on another planet, like that's really cool. And I think I wish that this was one of those things, is like, wow, like women could have like way more babies, and like the babies could be like super healthy, and we could like make sure that like there's none of these, we learned kind of bit by bit all of these awful things that can happen during pregnancy, right? Like fetal alcohol syndrome, and there's all these, unfortunately, there's these drugs that women were taking that were causing horrible, deformities in babies. So it's like, it's not that we haven't run that experiment on ourselves already. It's just that what can we learn to optimize it so that, we could have the healthiest of like the most kids. I don't know. It's something that I think is super exciting, again, probably from like this selfish motivation of like, it's something that I would want. But it does require, an enormous engineering effort. And I just think that we did that for something. I mean, to be clear, I love the moon mission. I think it's badass, and I'm glad we did that. But like, what would be the impact of an artificial womb compared to going to the moon? I mean, the moon mission came up with all this amazing technology that we're using, but like the impact of an artificial womb on society would be like, I think it could solve population collapse. I mean, again, there's all these like societal factors as well. I don't want to like be like one hammer technology solves all problems, but I think it would have a huge impact.
And I think a thing that people also miss is it comes in different levels, like how integrated the artificial wombs would be, and then also how many people would use it. So like a counter argument similar with everyone's doing IVF and everyone's doing artificial wombs. It's like the world's not going to look like that. It's not going to be the case that 100% use it. It's going to be 1%, then 2%, then 5%, and then you'll have some of them already use it for 10, 20, 30 years. And then you'll see how the children develop, whether they're developing healthy, and you will have this feedback as well prior to integrating it further and further into society, right? With both technologies, I think. So the worry about as if we switch it on tomorrow and now we've totally missed that this crazy thing is all a byproduct of it, that's just not how anything is going to actually be integrated into our world, I think.
I mean, that said, a thing that does reliably govern our world is incentives and economic incentives. And if it turns out that artificial wombs are just so much more economically efficient, even at a cost of the health of the people that then come out of it. There is that gradient that will then always have to be fought against. And I think we shouldn't underestimate that.
Yeah.
The Moloch problem, essentially.
Or that the artificial womb children are now the super soldiers that kind of just like run away with society because they're also like just tweaked in a bunch of ways.
Well,
but at the same time,
definitely. Those are real concerns. Like, I don't think it's.
I think, but that's what I also mean is it comes in different levels, right? Like as you pointed out, like right now we're already, if a baby is premature, then we put it into an environment which is akin to an artificial womb, just for that certain stage of development. And we're right now, our embryos are lying in a
freezer somewhere.
Freezer, which is also like, well, that freezer is making up the womb where it would technically
also,
currently be.
Also, does it not blow your minds that you guys have kids? You have embryos that are in suspended animation.
It's totally
Do you
insane.
realize that like there's been babies born that are like they were frozen for like 30 years?
Yeah.
Right.
So they're like could be older than their parents in some definition, right?
It's bizarre. It really.
Yeah, if younger parents had them, then afterwards.
Yeah, you could
someone
get
else
25
had it.
and just have a 30 plus year old embryo.
I also think like we should definitely study it, and I think a couple of years ago or so, the first mouse was brought to term in an artificial womb. As far as I know, like they had the.
I think it didn't get past at day 18.
No, I think it actually came, or they were very close to it. But basically, like there are two stages. Like the initial stage of just getting to blastocyst is easy, relatively easy, right? And then you have to put it in this environment where now the lungs, et cetera, need to develop. And that's hard.
I think that's Jacob Hanna's work, and I think
right. Yeah.
I think basically we should double check, but I'm pretty sure what happened is that it was transferred out of the mouse and into the artificial womb. So I think, but it was the longest ever. I think it was something like
they didn't quite reach the 21 days, whatever.
I think it goes like 15 or 18 days.
Okay.
Basically, like I think the part that's really hard is like implantation. That part of like basically how do you get the embryo and the
placenta actually
to combine. And I think what they were able to do is just because basically what we've been doing it from the other end of like, okay, what like critical developmental stages can we mimic? And then that's the one that seems to be the hardest is how do you get from the embryo to start growing?
And I think just on that, I talked to him and I think he said that something like 99 point some high digits afterwards as well, percent of the desired progress was the same as if it was in a womb up to that stage.
Yeah.
As if it was in a live womb.
Yeah.
And the problem that I have as a question around that is, okay, with a mouse, we are not going to notice if it has some mental health issue that it developed necessarily, right? Where if we bring it to a human, there might be other things where like those how many nines really matters in terms of similarity, and other things, as Liv pointed out, that we may miss. But again, that's why I mentioned the point of like it's kind of a gradual thing how it would be implemented, and probably you start with people that don't have the option to otherwise carry a child and they don't want to do surrogacy or something.
Do you know that there's literally uterus transplants? So there are women who get their current uterus transplanted out of them, okay? They get another woman's uterus transplanted into them. They're on immunosuppressants for like 6 months, okay? Then they do IVF. They have the embryo. They become pregnant. They carry a pregnancy for 9 months, and then they have that uterus transplanted back out of them. Like
what?
That's how much some women want to get pregnant.
Wait, back to the original person or?
No.
No, okay, it doesn't go back.
The other uterus is. Yeah.
So there's a lot of like discarded uteruses and so on. That's
and you
okay.
can imagine that.
But that is actually that's birthed. I think in the dozens of healthy babies. So so it's like that's what I'm saying. It's really on both sides. There's because that woman she could have chosen to find a surrogate. A surrogate could have carried that pregnancy. But some women really love and want that desire and connection to their child.
And you could also imagine that. The uterus that was implanted was missing some certain characteristics, so you actually artificially add a couple things, And then maybe you add a few more, and it's kind of like Theseus' uterus. And then it's like, at that point, is it still artificial or natural? Who knows?
Oh man, I'm going to get cancelled for this one.
Yeah. But I think just getting off, the point that you were making earlier about like, if you open this door, then it can create all these like perverse incentives, right? Like you can even think about that from what's already happened, right? So for egg freezing, right? Some people, their kind of more critical look at it is, okay, companies are offering this because they're just trying to like, work you harder and like, that's why they're doing it, right? And that's like, it's a nefarious motive, right? But like, I don't know how you would self-report your choice to do egg freezing or,
No, I did it entirely because I wanted to give myself optionality.
So I would say the same, but I think you could imagine a society where women are pressured that, okay, you shouldn't have kids before you're 45 because you can, right? So it's sort of like, I don't know, I think the thing that's really critical that matters is like, does the person really self-report that there was their free choice? Or is it the case that they're getting pressured by society or their employer or their
Economics,
family or whatever? And I think that's really hard to measure, but I think at least I can hopefully self-report most of the time whether I think I'm being pressured into something or whether I'm doing it of my free will.
Right. And again, like it's throughout history, women have been pressured over their bodies and their fertility choices. So
constantly.
It's a little unfair to just focus on this and ignore all the other pressures that have been passed down throughout history. And generally speaking, offering more options creates more choice, not less.
And presently, I think surveys show that women have fewer children than they would desire to have in Western society, at least.
Yeah, and I think part of that is the secondary infertility. And I think part of that is the, basically pressure on overparenting of like competing with the Joneses with the amount of parental effort that's given. And I think the other thing that I think was really recently debunked was, there's obsession with like breast is best, right? There's so many women for which breastfeeding is not fun, okay? It's like your nipples bleed and there's not enough milk. And it's like to pressure and make those women feel like they're somehow lesser or doing a bad job at being a mom, which is already like the hardest, most impossible job, is just so messed up. And now they know that they've like done so many more studies because this became such a meme and people were like obsessed with like, okay, breast milk is the best. It's been debunked and it's like, okay, the outcomes for children and for adults who, varying amounts of like breast milk versus formula milk are, very similar. And I think that, we should always research and find out, what truly is best. But I think in the absence of really having that definitively, captured, I think it's really wrong to then stigmatize women for one choice over the other when it's like it's just this situation for their body or for what makes them it doesn't have to be that you have this physical inability to breastfeed, right? For some women it's an incredible amount of time. Like if you calculate the amount of time that people spend breastfeeding, I think it's like, I don't even know, it's something absurd. It's like 6 hours a day, like for like an infant, and it's like some women just don't find that fun, and that's okay.
It's throughout the night.
Yeah.
You get 2 hours sleep at most, and not great for the baby either. You're gonna have a grumpy, borderline crazed mum because she hasn't slept.
Yeah.
The thing that I think we only can find out empirically, and that also matters around that is, okay, so we have given ourselves optionality, right? But we'll never be able to run back the counterfactual of whether we would have had a child then at 37 versus how we are currently in a situation where we're probably going to have one at 41 when you're 41 or so, right, for the first time. And then we won't ever know whether we would have had more in the we're pressured to do it or we're enabled to do it later. So I think that's one interesting thing where whether you know of any surveys there. And then the other one I'm also curious about whether presently people who have been given the choice of sex have chosen one sex over the other statistically.
Oh, those are both really interesting questions. So yeah, I think one thing is that people, it's really hard to run the counterfactual, right? Because some people who have kids super young, they're like, oh my God, I like love being, a young parent and, being young at their wedding and all the other things, right? But then, they gave up all these, being independent when they were young, right? So it's really hard. I don't think you can prescribe for one person one specific thing, right? For some people, it's going to be the great decision to have kids at, 17 or 20 or whatever age. Like that was it really solidified them into adults. It gave them more responsibility. It got them on the right career path. It got them to like take their lives seriously. There's that story. There's also the other story of like, I really wanted to be, independent until I was, 30, 40. I mean, people are having kids when they're, 45 or 50, older than that as well. So it's like, again, I think it's like a super personal decision to like that individual, that couple, that time, what their ambitions are. Like there's certain ambitions that you have to do when you're young. There's certain ambitions that you can do when you're older. It really just depends on, what matters to you in your life. And then for the sex selection stuff in the US, there's actually a bias toward women or girls. And that's because of a number of factors. So one, people who are doing it, historically, we've had a really low resolution understanding of genetic issues, right? So a lot of times females are like less likely to develop autism and a lot of these other psychiatric conditions that parents are trying to prevent. So in the absence of actually being able to quantify the risk, they'll just say, well, girls are less likely to have it. So that's one reason.
How strong is it? Do you know
I don't think it's very strong. I think it's like a slight preference toward girls. I don't think it's super strong. And I think similarly, that's probably why it was banned or censored in India and China, is that there's a really strong, unfortunate, I think, economic incentive, right? If you have a male child, that affords you a lot, basically the way that it is sometimes structured is that, okay, a female child is basically a net cost and then a male child is a net gain. Right. And that's, again, really screwed up that society is structured that way, where someone would literally, kill a female child. But, I think, it makes sense in that context to censor that information for that reason. And I think now that we have all this information, maybe we'll decide that certain information should be censored because of, info hazard, right? There is this idea that certain information, maybe we wouldn't want to know the exact time and date of your death, right? There's some things that we're, unpacking and finding out that, maybe would contribute to that info hazard. Like some of our users, for example, they'll only want to know about pediatric conditions and not adult onset, right? Or they'll only want to know about things that affect their embryo, but they wouldn't want to know things that affect themselves, right? Because sometimes when you test your embryos, you can find out something about yourself. So all of these different combinations of I know maybe saying censorship sounds too negative, but basically of which information is going to be useful to you in this context versus not. Again, should be an option. But I mean, maybe it's information overload, right? Like I hate when I go to the grocery store and there's 70 different types of ketchup. You're just like, oh my God, come on, just one. But I think the default in this category has been the opposite of just one size fits all. You have to do it this way. You have to do it at this time. If you don't, you're going to be, an outcast. And I just like that it's pushing a little bit in the other direction.
So to finish up, what would your ideal 30 or 40 years into the future techno fertility world look like, and why is it a win-win in your mind?
My dream would be that, we can slash incidence rates for every major disease within, a single generation or a few generations. And that's just fully off of the free choice of parents to, mitigate risk for, all of these, diseases that we currently know about. So that's, I think, something super exciting is that people, freely choose to have the child that they're best equipped to take care of, where they, basically they thought through all the implications of having this specific kid and they chose it and they love it and they take amazing care of it. So I would want that to happen. I would want, artificial wombs to happen and that they're safer and super optimum. And, they help people who, want to have more kids have the ability to. But also at the same time, people are pressured and feel like if they want to experience pregnancy, that they're somehow, pressured into having it one way or the other. So yeah, basically a world that's less dogmatic, that's super evidence and data focused on the things that we can measure, but also humble and acknowledging the things that can't be captured in data that could also be important, right? Like the emotional piece of it. So I think it's just sort of I would love, I don't know. I just would love people to basically accept both sides of it. There's an emotional side to it and there's a data side to it, and don't try to minimize either. Don't be arrogant, right? Just be humble about here are all the things that we can learn. And hopefully artificial wombs, embryo screening, and us living a lot longer too, right? So that we can spend more time with our kids.
So there we go, folks. Thank you so much for tuning in, and a huge thank you to Noor for taking the time to talk to us. Hopefully this was illuminating about, well, not only Igor and my personal life, but some of the technologies that are on the horizon for people who are prospective parents. As always, lots of links in the show notes. Hope you enjoy. Happy reading, and I'll see you next time.